Every year, some 20,000 women die while giving birth in Ethiopia, and another 400,000 face lifelong disabilities from complications during pregnancy in this poor African nation. 5 weeks ago, 27-year-old Samuni Kito gave birth to a stillborn, her 8th child. She was lucky to survive.
My husband thought that the heavy work I was doing was the reason for the stillbirth.
In Ethiopia, it's common for women like Samuni to fetch heavy loads. She and her husband are subsistence farmers. They depend on their own crops to feed their family. Barely surviving off the land, they just can't afford the additional medical costs for a hospital delivery. So they rely on the traditional practice of home births. Dr. Lulu Alibechu, practicing at Awasa Hospital, believes that apart from costs, women resist hospitals because of their safety records. 2 years ago, there were massive deaths because of a shortage of a critical drug that prevents hemorrhaging.
There was no oxytocin in the country, and we have lost lots of mothers because of the lack of these drugs.
Hemorrhaging is the cause of 23% of all maternal deaths in Ethiopia. And oxytocin is a life-saving drug. Without it, this woman would have bled to death when her baby was trapped in her birth canal. To improve maternal health, the government of Ethiopia is determined to implement a primary health care plan by 2010. In addition to providing clinics and hospitals with free drugs, the plan is also pushing for an increase in family planning and contraceptives, says Minister of Health Dr. Tedros Ghebreyesus.
If the contraceptive prevalence increases, then mothers will have less labor and less risk.
Samuni can't get over the death of her last baby. She almost lost her life and is not willing to do it again.
I thought I was going to die.
She took matters into her own hands by visiting a nearby clinic in Kofale, her hometown. After a demonstration, she finally decided to use contraceptives. This means that she must come every 3 months for new supplies. The United Nations Population Fund, UNFPA, and its partners gave $25 million to the government to meet its contraceptive needs in support of maternal health. Dr. Monique Rakotomalala, resident representative in Ethiopia.
The coverage is for 2 years now. We have bought for 25 million contraceptives since 2004, since the program has started.
Samuni and others are learning that contraceptives and skilled care at a hospital or clinic could save lives. Ethiopia is striving to double its contraceptive prevalence rate to 60%. But more needs to be done to ensure a robust health force and adequate supplies are available to handle the 2.6 million births that occur each year. This report was prepared by Mary Ferreira for the United Nations.